There are new rules governing COVID-19 testing in India, and there are fears that it could mean fewer tests will be carried out despite a worsening crisis. The government says that screening can be skipped for healthy interstate travellers and patients who've recovered. The move is to relieve pressure on diagnostic labs. At the same time, the country has passed another grim milestone, 20 million infections. Live to Ishan Garg in a moment, but first, a look at how the crisis has been unfolding over the past 24 hours.
Devastation laid bare as India's COVID-19 death toll sets a new record. Around 3,700 more people have lost their lives in a single day. Morgues and crematoriums are overflowing. Many have died in ambulances and car parks, waiting for a bed or oxygen. The World Health Organization says India accounted for 1 in 4 global coronavirus deaths over the past week. Experts predict the death toll may double in the coming weeks, with some models projecting more than 1 million by the end of July. And as the toll mounts, children could also pay the price.
Adults are grappling with it. You cannot imagine what's happening with children. With so many adults, caregivers, and parents falling ill, children do face a trauma. Increased number of children are calling helplines, asking for support.
International aid continues to arrive as countries work to help India weather the crisis. But experts warn it's not enough.
पेशेंट जो हम बढ़ा नहीं पा रहे हैं उसका मेन कंस्ट्रेंट हमारे को ऑक्सीजन से आ रहा है, लेकिन जो एलोटेड एजेंसीज हैं वो बहुत कम ऑक्सीजन हमें दे पा रही हैं जितनी हमारी रिक्वायरमेंट है उसके हिसाब से.
The government insists there's no supply shortage. Even so, some hospitals are now turning to the courts for help. Petitions seeking oxygen have been filed on a nearly daily basis in Delhi. With the court's intervention, one hospital received aid with less than 30 minutes of oxygen left for around 40 patients.
We've also seen places where some healthcare centers may not have anything beyond a paracetamol. They won't be able to handle the crisis or manage the illness in such a scenario.
Calls for a full national lockdown are mounting, but Prime Minister Narendra Modi is resisting the move over concerns for the economic fallout.
Ishan Garg joins us live now from New Delhi. Ishan, these new rules mean there'll be fewer tests. Aren't officials concerned about possible coronavirus reinfections?
Well, officials are certainly concerned about it. As a matter of fact, in a press conference delivered today, the principal scientific advisor to the government said that the variants that are currently prevalent in India, there are about 30 variants of concern, and a number of them, he says, are capable of escaping immunity, which essentially means that folks who've already contracted COVID-19 or people who've been vaccinated, they can also get the infection once again. And he says that this is something that the country should prepare going forward. It's also necessary to note that in the press conference today, it was said that the variant first discovered in India, the B1617, is responsible for a massive surge in infections. And this is one of the variants that several health experts have told me that is not showing up on RT-PCR tests. So it all gives you a sense that how important testing is now than it was earlier. And in this moment, the government has decided to cut testing effectively. But on the government defends its move by saying that people who are showing symptoms, they are the ones who need to get tested first so that appropriate medical care can be provided to them. The second point about traveling and mandatory testing before traveling, the government says that, well, the bulk of traveling actually happens through trains and buses in the country and not through domestic flights. So it would be important to track people and contact trace effectively rather than wasting resources on people who are traveling via flights. So the government's response here, it seems, is that by reducing the burden on the laboratories, it will be able to get results faster and quicker and therefore prepare its pandemic response in a much more effective way.
Meantime, Ishan, calls for a full national lockdown, they're getting louder.
Absolutely. This is something we are hearing from several high courts in different states in the country, as well as from public health experts. They are recommending that a nationwide lockdown has to be implemented. But the government so far has resisted this idea. They say that when a nationwide lockdown was imposed last year, hundreds of millions of people lost their jobs and pushed the country down in terms of its economic GDP growth. And that's something that the government does not want to repeat again, because the economic ramifications of that are going to be too huge. But at the same time, the government has also recommended locking down states and several districts. And in this manner, it has passed the buck on to local governments. The new guidelines that have been released by the federal government say that if positivity rate of RT-PCR tests in district is above 10%, the state can lock down. Or if 60% of hospitals in any district are occupied, this district can be locked down. And in effect, several districts across the country where the caseload is high do fulfill these two criteria. And because of that, we have seen restrictions being imposed in almost 20 different states across the country. But there is chatter in the political circles as well as government insiders who are saying that a move concerning a nationwide lockdown might be on the cards, and something along those lines might be announced or even considered in the following few weeks.
Ishan Garg there, reporting live from New Delhi.